Welcome to the Medical and Surgical Weight Loss Clinic Patient Information Session. This is a partnership between HSHS Sacred Heart Hospital and Evergreen Surgical. My name is Dr. Brandon Andrew, Clinic Director. This presentation is for anyone who's suffering from obesity or its related diseases such as diabetes, high blood pressure, or sleep apnea. Bariatric surgery can be a life-changing event, and we here at the Medical and Surgical Weight Loss Clinic are here to help you on your journey towards a happier, healthier life. When you are finished viewing this presentation, please browse our website, YouTube, and Facebook pages, and then if you haven't already, please schedule an appointment by calling Evergreen Surgical at 715-832-1044. This presentation will focus on the obesity epidemic, treatment options, requirements for surgery, and what to expect before and after surgery. Obesity is common, indiscriminate, costly, morbid, and deadly. America is in the middle of an obesity epidemic. You can see that 35% of adults are obese. This is 78.6 million people. There's also a large number of obese adolescents as well as children. We describe obesity using the BMI scale, which is your weight in kilograms divided by your height in meters squared. The normal BMI is 18 to 25. Overweight, 25 to 30, and obesity greater than 30. The prevalence of obesity has increased dramatically in the United States over the last several decades. You can see that in the 1980s, there wasn't one state with greater than 20% obesity. Now, every state has greater than 20% obesity, and here in Wisconsin, we have greater than 30% obesity. Obesity is a worldwide problem, with many developed countries having obesity rates greater than 40%. The medical costs of obesity exceed $200 billion per year. Additionally, obese individuals have higher per capita costs for obesity-related diseases such as stroke, coronary disease, diabetes, high blood pressure, and high cholesterol. Obese individuals have greater than double risk of high blood pressure, 3 times the risk of diabetes, and almost double risk of heart disease or stroke. Obese individuals also have a 20 to 30% increased rate of inpatient admissions, ER visits, and outpatient visits. There is an increased risk of surgical site infection after hip or knee replacement, 30 and 8 times respectively. There's also more than double increased risk of stroke after vascular surgery, and hospitals have a difficult time transporting, imaging, examining, and placing IVs in obese individuals. Obesity increases the risk of diabetes, high blood pressure, obstructive sleep apnea, high cholesterol, reflux disease, infertility, polycystic ovary disease, and there's an increased risk of social discrimination and decreased quality of life. Obesity causes over 300,000 deaths each year in the United States. This makes it the leading cause of preventable death, having overtaken smoking. This means that for a 25-year-old male who's morbidly obese, he has a 22% reduction in life expectancy, 12 years of life lost. There are multiple factors that contribute to obesity. Those are host factors such as biology and behavior, environmental factors such as proximity to grocery stores, and vectors such as energy density of food and portion sizes. Portion size in America has increased dramatically. For example, in the 1950s, a popcorn at the movie was 3 cups, now it's 21 cups. And a Hershey bar was 2 ounces, now it's 7 ounces. Furthermore, we consume a much higher portion of high fructose corn syrup and less natural cane and beet sugar. We've blocked the names of these beverages to protect their identity, but you can see it's easy to get between 500 and greater than 1,000 calories in a single milkshake or high-calorie coffee drink. There are establishments where you can have a breakfast of almost 2,000 calories and then a dinner of 2,800 calories, not to mention an excess amount of sodium and saturated fats. Almost half of Americans get insufficient physical activity. This is due to little physical activity during leisure time, increased sedentary behavior, and increased use of passive modes of transportation. The American Heart Association recommends 150 minutes of moderate intensity activity per week. That's 30 minutes a day, 5 days a week. Most people don't get this level of physical activity. The image on the left is a map of food deserts in Wisconsin. The green and yellow areas outlined on the map are regions where, due to lack of grocery stores or limited transportation, patients have poor access to fresh fruits and vegetables and rely on fast food instead. The image on the right shows you that Wisconsin has 3 times the number of bars compared to grocery stores. There is a strong association between parental obesity and personal obesity. Children are 3 times more likely to be obese if the father is obese, 4.5 times more likely if the mother is obese, and almost 12 times more likely if both are obese. Fortunately, society's perception of obesity is changing. In the past, obesity was seen as a weakness or failure of the individual. Now we understand obesity to be a multifactorial disease, as well as the cause of many other serious diseases. Treatment for obesity includes diet and lifestyle interventions, medical treatments, as well as surgical interventions. Diet and lifestyle interventions are the cornerstone of any weight loss program. This includes a low-calorie diet, physical activity according to recommendations, as well as behavioral therapy such as monitoring of food intake and regular weight checks. Patients typically lose 5 pounds with this approach. However, any weight loss can lead to improvement in associated medical conditions. There are medical interventions available for weight loss. These are typically appetite suppressants, antidepressants, or a combination of both. Excess weight loss is typically 5 to 15%. However, weight regain occurs if the medication is stopped, and there are notable side effects. Only bariatric surgery has proven effective over the long term for most patients with clinically severe obesity. This was stated by the National Institute of Health in their Consensus Conference Statement in 1991. And this statement is essentially agreed upon by the medical institutions you see listed below. Here at Sacred Heart, we put together a pathway to help you through your journey through weight loss and towards a happier, healthier life. We have an excellent team of dietitians, physical therapists, psychologists, primary care physicians, pharmacists, and nurses, and we're all committed to helping you throughout the entirety of this process. First, the requirements for surgery. These requirements vary by your insurance provider. However, in general, you have to have a body mass index greater than 40, which usually equates to 80 to 100 pounds overweight, or a body mass index greater than 35, with an obesity-related condition such as diabetes or high blood pressure. We're looking at adult patients, and you must have made attempts at weight loss through diet and exercise before considering surgery. You must also be willing to follow the diet and exercise plan both before and after this surgery. Not eligible for surgery are those with obesity caused by a metabolic or endocrine disorder that wouldn't benefit from surgery, or those with untreated major psychological issues, or those who are non-ambulatory. However, we do strive to help all people who come to our clinic, even by non-surgical means. We offer the gastric bypass as well as the vertical sleeve gastrectomy. These are the 2 most common weight loss surgeries performed in America. For the gastric bypass, we create a small stomach pouch as well as change the routing of your small intestines. This helps change how much you can eat at one time as well as how much food is absorbed. You can expect to lose approximately 60 to 80% of your excess weight. There's a risk of complication with any surgery, and for the gastric bypass, those include wound infection, internal hernia, stricture, leak, as well as marginal ulceration. These are ulcers at the connection between the stomach and small bowel, and they can be caused by smoking, NSAID usage such as aspirin or Aleve, or certain infections. And for this reason, patients who have the gastric bypass can never smoke or use NSAID pain medications. For the gastric sleeve, we remove 80% of your stomach. The remaining tube-shaped stomach limits the amount you can eat as well as helps food move through faster. You can expect to lose 60 to 70% of your excess weight. Complications associated with the gastric sleeve include wound infection, leak, gastric reflux disease, as well as nutritional deficiencies. Some patients have asked about the gastric balloon. The gastric balloon is exactly as it sounds, a balloon inflated inside your stomach, which helps you lose weight by restricting the volume available, increasing your feeling of satiety, as well as decreasing the rate of gastric emptying. The expected average weight loss is about 25% over the 3 to 6 months in which the balloon is in place, and a third of patients can see improvement in their diabetes. Complications can include rupture or migration, as well as injury to the esophagus during placement or removal. Several different types of gastric balloons were FDA approved in 2015 and 2016, so there's no long-term data yet available. However, a few questions remain regarding their effectiveness. Given that the excess weight loss may be 25%, which in a BMI 40 patient could only be 25 to 30 pounds, there's a question of whether it's really worth it for most patients, given that it's not covered by insurance and the out-of-pocket cost may be $8,000 to $14,000. However, the gastric balloon may fill a role for patients with a moderate degree of obesity who don't want to undertake the risks of surgical intervention, but need more effectiveness than can be provided by diet and exercise alone. The Gastric Band was very popular in the early 2000s, and now is very, very uncommonly used. The Gastric Band was plagued by complications including erosion, band slippage, infection, and poor weight loss. Approximately 50% of the costs related to the Gastric Band are for reoperations and removals. I don't place the Gastric Band, and neither do the vast majority of my colleagues. In fact, in the last year and a half, I've taken out a couple dozen bands and placed none. When we talk about excess weight loss, we're referring to your weight above a BMI of 25. For example, a patient who's 5'10 and 330 pounds, male or female, for a BMI of 47, after a 70% excess weight loss, they would be expected to achieve a weight of 225 pounds, a BMI of approximately 32. It's important to note that this is still in the overweight range, but not obese. Some patients have achieved 100% excess weight loss as well. Both the gastric bypass and the gastric sleeve are performed laparoscopically. This means making several small incisions and a laparoscopic camera rather than one large incision. After your initial visit with me, you'll have a consultation with the dietitian and then a 5 to 6 month period of supervised diet, as well as monthly education modules and monthly weight checks. There is often a psychological evaluation required. This involves a consultation with a psychologist who will assess your ability to make changes needed for post-surgical success. This includes a clinical interview, as well as psychological testing such as eating pathology, as well as testing of cognitive function. We have physical activity counseling prior to surgery. This is intended to identify and address barriers to activity prior to your surgery. Having a high aerobic fitness at the time of surgery can lead to an easier post-operative recovery. We'll submit your information to your insurance provider once all the requirements are completed. Each provider has their own specific requirements, and we'll help you work with them. You will then have a final clinic visit, a primary care visit, a pharmacy visit to adjust medications as needed, and you may be on a 5 to 7 day liquid diet prior to surgery. Your surgery will be at Sacred Heart Hospital. On post-operative day 1, we will begin reintroducing clear liquids. We're expecting a hospital stay of 2 nights. The diet progression after surgery will consist of the first 2 weeks being clear liquids, then we'll gradually advance you to full liquids and pureed foods over the next 2 weeks. The next 2 months will include a soft diet, and then you'll gradually return to a healthy, balanced diet consisting of small meals of solid foods, while being sure to maintain an adequate fluid intake to maintain hydration. You will require lifelong clinic follow-up, however this becomes less frequent as time goes on. You'll need lifelong vitamin and mineral supplementation. We encourage continued exercise according to the guidelines, and we also have support groups and referrals to local gyms and fitness centers available. You may also seek plastic surgery consultation once your weight stabilizes for abdominoplasty, also known as tummy tuck. Frequently asked questions regarding bariatric surgery. Is it possible to regain weight that is lost? Yes, it is possible. To be successful and maintain a healthy weight, you must commit to an appropriate diet and exercise program. Can I still get pregnant after bariatric surgery? Yes, obesity can make it difficult for some women to become pregnant, and bariatric surgery can actually improve fertility. If you want to become pregnant, we ask that you wait 18 to 24 months following surgery to allow your weight to stabilize. Do insurance companies pay for bariatric surgery? Yes, most insurance companies cover the cost of bariatric surgery. We'll help you review your policy and ensure you meet their specific requirements. There's also a self-pay option available. There are many studies examining the effectiveness of bariatric surgery. In a retrospective cohort study, 2,500 patients who underwent bariatric surgery were compared to obese patients who did not undergo bariatric surgery. Over a mean follow-up period of almost 7 years, it was found that patients who underwent bariatric surgery had significantly lower mortality, meaning lower risk of death, over all periods studied. In another study, looking at 7,900 patients who underwent bariatric surgery compared to obese patients who did not, and over a follow-up period of 7 years, it was found that there was a reduction in the rate of death from cancer of 61%. There are many other studies examining the effect of bariatric surgery in terms of mortality and comorbidities, and those can be found on many websites such as the ASMBS website. An amazing thing about bariatric surgery is that we expect to see a cure or resolution of your obesity-related diseases such as diabetes, high blood pressure, sleep apnea, high cholesterol, or polycystic ovary syndrome. We also find that singlehood is reduced as well as unemployment and disability. In summary, bariatric surgery will lead to a 60 to 80% excess weight loss, and additionally, improvement in self-esteem and quality of life, a longer life, reduced risk of some cancers, a decrease in the amount of money you spend on diabetes or high blood pressure medications, improved fertility, and a decreased rate of complications during pregnancy or any other surgery. Again, we want to stress that bariatric surgery can cure or improve your obesity-related conditions such as diabetes, high blood pressure, sleep apnea, high cholesterol, arthritis, joint pain, reflux, fatty liver disease. And finally, regardless of the numbers on the scale, you're going to feel happier and healthier when you don't need the extender seatbelt on an airplane, can make it up the stairs without breaking a sweat, are not embarrassed to take a picture, can wear clothing that you've had in your closet for many years, and you can fit comfortably in any seat. Please don't hesitate to contact us for more information or to schedule an appointment. You can reach us at Evergreen Surgical, 715-832-1044. Thank you for your time and attention.